Welcome back to County Connection. For this next segment, we are going to be recognizing National Telecommunications Week. And here to help us celebrate is the one and only Bill Pessemier, Director of the Summit County 911 Center. Welcome, Bill.
Thanks, Julie. Glad to be here.
All right. So National Telecommunications Week is April 11th through the 15th.
Correct.
And for folks who may not be familiar with that technical term, shed some light for us.
Well, telecommunicators are basically the new term for dispatchers, for 911 dispatchers.
Okay.
Yeah.
All right. So tell us in broad strokes, what does the Summit County 911 Center do?
Right.
What do you have going on over there?
Well, when something goes wrong, when an emergency occurs, people call 911, which is a really good thing. It used to be in the old days when I first started in public safety 30 years ago. Every community had a different 10-digit phone number and sometimes a different one for fire departments, police departments, emergency medical services. So now we have the 911 number. So when people call the 911 number, we're there to answer that call. And what we will do is gather information about the location of the emergency, about the type of the emergency, so we know what's the appropriate response to send to that emergency, whether it's police officers, firefighters, or paramedics, or some combination of all three.
Sure.
And we try to send that help as quickly as possible. There's a saying that seconds matter, minutes matter when it comes to medical emergencies if somebody's in cardiac or respiratory arrest. So we try to do that as quickly as possible, get the first responders on the road responding to the call. But then we also support the first responders as well. And one of the most important things we do there is what's called emergency medical dispatch, or the dispatchers are able to provide what's called post-dispatch instructions. And these are instructions to bystanders that help them, for example, to perform CPR if somebody's in cardiac arrest, or how to control bleeding if somebody's suffering from trauma. So the dispatchers can actually start the process of providing emergency medical care before the first responders actually arrive on the scene.
Wow. So you guys really are the hub of communication when it comes to any emergency response throughout the county.
We really are. And the 911 dispatchers, people don't see them. They don't have, they have an interaction with them over the phone, and then they're kind of gone. So they're kind of the unseen heroes of first response, I think.
Right.
Yeah.
So tell us about the call volumes in Summit County. Obviously, we have a lot of seasonal variations in our level of activity up here, being a tourism-based economy. So how does that translate to your world?
Well, to start with, we get about 86,000 phone calls a year into the 911 center. Most people don't realize how many phone calls we deal with. We also dispatch about 46,000 calls for service every year. So that translates into about 225 phone calls every day and dispatching 125 calls for service every day.
Wow. And so how many staff members are there to handle those 225 phone calls?
It's pretty minimal. We average 3 people in the 911 center. There are times when we try to staff up during the busy days and weeks and months of the year.
Sure.
So sometimes we'll have 4 people on duty, but there are times during the day where we may have 2 dispatchers on duty, or sometimes in the very, very early morning hours on some days during the week we'll have 1 person on duty.
Oh, wow. Okay.
Yeah.
So looking at that total call volume, how does it break down in terms of the type of response that's required?
Right. Well, all the phone calls that we get coming into the center, about 18,000 of those are actually calls on the 911 lines. So we get about 64,000 administrative calls. But these are calls from people, for example, that somebody broke into their place and they're calling on the non-emergency line to say, hey, somebody broke in, you need to send a police officer out to take a report, or other kinds of information that people need that we provide. As far as the incidents that we dispatch, about 38,000 of those are law enforcement related, or about 83% of them, and about 8,000 are fire and emergency medical service related.
Okay. And then, so you obviously track and analyze all that data and slice it and dice it a million different ways. So what are the things that really jump out at you that people might find interesting, or you feel that kind of tells a story about our community? Yeah,
a number of things. First of all, the way the 911 calls come into our center, about 81% of those calls come in on cellular phones, and so only about 19% on landlines. And that's important to us because the location information we get from the phone system as it comes into the 911 center is very different depending on how it comes in. So for example, on a landline, we get location information that specifically states the address of that phone.
Okay.
So we know exactly where that person is when they call in from a landline. On a cellular phone, we get latitude and longitude. And we get information that gives us an idea of how accurate that location is. So if, for example, if you ever look on your cell phone, sometimes when you're look on the map and you're looking up a location, you'll see a circle on your cell phone, and it'll be bigger, and then it'll get smaller, and then smaller, and then it'll point to where your location is.
Right.
Well, that's the satellites positioning, getting information, or your phone's collecting that information and getting that in that site, pinned on your on the map. Well, that's exactly what happens in the 911 center when somebody calls in on a cellular phone. That we get the GPS information, the latitude and longitude, but we also get information about how confident we are and how certain we are about that location. And sometimes in the geographic mountainous area of Summit
over
County,
there, down there.
and actually Officers Gulch is one of the more difficult ones because of the mountainous environment. It's very difficult to get an accurate position. But most people think that because they're calling on a cell phone and it has that capability, we know exactly where they are. And really many times we don't, because we're just not getting accurate information.
Right.
And that's more of a problem for us up here in this mountainous environment.
Sure. So the satellites can't see you if you're tucked around a little gully.
Exactly.
Okay.
Exactly. Yeah. And then looking at the call load, as you would really kind of expect in a resort community, December, January, February, March are four of the highest months. We get about 10% of the calls each month, so about 40% of our calls come in over the winter.
Okay.
We're seeing almost the equal amount of call load during the summer, during June, July, and August, where another 10% each month, or 30% of our calls come in the summer. And then the workload in the mud season in between is half of that.
Okay.
Which is again very different. In an urban, metropolitan environment, you would see a very consistent call load by month of the year.
Right, which makes it a little simpler in terms of budgeting and staffing
and all that.
projecting.
Exactly. Yeah. And then there's differences up here in the day of the week. Friday, Saturday, Sunday makes up 50% of our call load because everybody's coming up here. And again, so you see a lot of variation by day of the week, which is different than what you see in metropolitan, urban, suburban areas.
Okay.
And then as far as the types of calls, on the fire and medical side, the fire and EMS side, medical calls make up about 56% of the total number of calls for the fire departments and ambulance services up here. Another 11% are automatic fire alarms, and another 9% are motor vehicle accidents. So those three call types make up about 76% of the total call load on the fire and ambulance side. On the law enforcement side, traffic stops are by far and away the biggest call load. 28% of the calls that we handle are traffic stops on the law enforcement side. The next highest call type is parking complaints, and that makes up 5% of the call load. So they all drop off significantly after that. There's like animal complaints and motor vehicle accidents make up 4%. But the good news there is that there's not a lot of serious crime in Summit County to have to worry about, just a lot of bad drivers.
Yeah, I guess I'd rather have bad drivers than serious crime, so that's good.
Right.
So a wide array of agencies utilize your services.
Right.
So then how does that work out in terms of your funding streams?
Well, the primary agencies that use the 911 center, obviously all the emergency services. So there's the three fire departments, Red, White, and Blue, Lake Dillon, Copper, Summit County Ambulance, and then 5 law enforcement agencies, Summit County Sheriff, and then the police departments for the 4 towns in the county. So we have user agency contributions. Each of those user agencies contribute a certain amount, and that's based on the call load in those jurisdictions and their population. There's a formula that figures out that we use to figure out how much each agency pays. But for example, in the 2016 budget, that total comes to about $1.2 million of our budget. Another source of funding is the 911 surcharge, and that's a surcharge on telephone lines. Any phone line registered, whether it's cellular phone, VoIP phone, landline phone, any phone is charged $1.75 per phone per month. And that generates about $722,000 every year.
Right.
So that's part of our revenue.
Okay. And that particular funding stream is a little tricky for our community because those Summit County locals who have been here for years and years and years, or were born here, are rare. And so
Yep.
we have lots of folks who have cell phones from other places.
Right, exactly. Yeah.
So they're paying someone else's 911
Right,
center.
some other county in some other state or whatever. Yeah, exactly. Yeah, and we've seen that the revenue from that drop. We had tried this last year to go from $1.50. The surcharge was $1.50 up until it was 2014, I think, and then we went through the process with the Public Utilities Commission requesting that surcharge be increased to $1.95, and they would not support that. So we agreed and settled on $1.75, which left us short in terms of the long-term planning for technology improvements.
Right.
Which is why the Safety First Fund is so important. That's the third source of funding. And for example, for this year's budget, it provides about $1 million of our funding. So
Thanks to the generosity and support of Summit County voters.
absolutely, yeah.
So, so let's go ahead and go down that road and talk about technology and what's out there on the horizon for 911 operations to be more efficient and more effective, and when can we expect to see some of those here?
Yeah, well, we're working on replacing our computer-aided dispatch system. There are several different systems that we use, and really very complex technology systems. One is the 911 phone system. We replaced that a few years ago. So that is a very kind of state-of-the-art phone system. Our computer-aided dispatch system is what we use to determine, once we get a call type and the location, we use that to determine which unit should be sent to that call and manage all sorts of data that comes in, about the call through the computer-aided dispatch system. And then the different agencies have records management systems, and we take data from the CAD system and transfer it to their law enforcement or fire or ambulance records management system. Okay. So our current computer-aided dispatch system is old. It's 10 years old. That's very old technology when it comes to this kind of stuff.
Right. If you've got a laptop at home that's 10 years old, it's time to get a new one.
You're in big trouble. Yeah.
So for a system as complex as yours.
So we're in the process of replacing the computer-aided dispatch system. We just received responses from 4 different vendors to a request for proposal on that. So that has, we're excited to get those back in. They all came in pretty much around the budgeted number that we thought to expect, so that was good. So we should see the new computer-aided dispatch system up and running by close to the end of this year, early 2017. These, again, they're very complex systems. It's a major project to replace these things get a new one up and going. So the other thing is that we're going to be looking at an upgrade to the current phone system. The phone system that we went to is upgradable to be able to handle next generation 911 type phone data. So that's a relatively inexpensive upgrade. It's about $50,000, but we're looking at trying to plan that out with other 911 centers in the northwest region of Colorado. So we can all do that together, so we can share and back each other up with 911 phone calls. So if the 911 center in Eagle, for example, goes down, we can take their phone calls and reroute them and help them get them dispatched, or they could do the same for us, for example.
Great.
So we're looking at other kind of technological infrastructure improvements, and then of course with the Safety First data, we've added another technical support position and another dispatcher position. So again, very grateful to have that kind of funding. It's really providing some very important critical infrastructure and staffing needs for the 911 center.
All right, fabulous.
Yeah.
So lastly, the 911 center is one piece of the equation in terms of getting emergency services to the places where they need to be. So another part of that equation is the person who's making the call in the first place.
Exactly.
So what are some tips you have for folks so that they can help your folks do their job?
Yeah. Well, the very first question that the dispatcher is going to ask anybody that calls on 911 is, what's the location of the emergency? So it's really critical to know where you are. And because, again, we're a resort community, about 25% of the people that call 911, when we ask them that question, they basically say, I don't know.
Wow.
Or they say, well, I know I'm in Colorado. I mean, we really actually had this happen. I know I'm in Colorado and I can see trees. And that doesn't help us a whole lot.
Not
And
too
especially,
much.
again, if our latitude and longitude, the cell phone is not giving us a really good location,
Right.
it can take minutes to get a good location, to figure out how people, and figure out where they are.
So do you ask like what species of tree? Or?
Yeah, to see which
Narrow
part of
that.
the altitude they're in and that kind of thing. Yeah, so that can get very difficult. And again, it takes a lot of time to figure that out. And of course, time can be a problem if somebody's having a really critical emergency. So
Right.
the most important thing is to know where you are. People, for example, have told us that they're on Main Street, but they weren't sure if they were on Main Street in Frisco, Main Street in Breckenridge.
Okay.
So knowing where you are and finding some kind of an address near where you are, or the name of a store, because our CAD systems can recognize, for example, Walmart. Well, they just type in Walmart and the address for Walmart will come up.
Okay.
So if they don't know the address, to look at the names of different businesses or restaurants or whatever around them, that would help a lot. So the location of the emergency, and then information about exactly what's going on, what has happened, so we can determine whether or not we need to send police officers or firefighters or paramedics or all of the above. So the location, exactly what's going on, and then the phone number you're calling from, just so if there's a problem and something happens, we know right away what number we can call to get
Right.
back to that person.
And property owners who rent out their properties as a vacation rental, they can play an important role in this as well, right?
Well, they really can. And again, by making sure that people that rent their properties out know what the address of the property is. So providing information for them, whether it's a little card or something on the kitchen counter or something like that, or the back of the door that says the address here is this, so that if you have to call 911, you know exactly what address information to give them. That would be incredibly helpful if more people did that.
Okay, great.
Yeah.
Any other tips you have for folks in terms of utilizing the 911 system?
No, I don't think so. Except that this telecommunications week is coming up, and so it'll be a good time to thank your dispatcher.
All right. Should they call not the emergency
Do
line?
not call 911 to do that. Yeah, call the administrative line and just say thank you, or bring cookies.
Okay, that's
down to
good.
the
Maybe
building.
just
Yeah.
don't call.
Yeah,
Bring cookies.
yeah,
Sounds
yeah.
good. All right. Well, thanks so much for coming by
Yeah.
the studio today, Bill. It was great to hear all of the inner workings of the Summit County 911 Center.
My pleasure, Julie.
All right, stick with us. We're going to take a quick break, and when we come back, we're going to be talking about National Public Health Week.